They told you it's burnout, but they lied. It's nurse trauma. Your body never lied. The system did. I'm Dr. Lori Laws. Let's get into it. I want to start today with a nurse who wrote in named Claire. Claire feels a pit in her stomach every time she opens the ED doors for her shift. She's 18 years in, and she dreads going to work every single day. She's finding herself wondering if she can even make it to retirement. Her exhaustion, it's the new normal right now, and no amount of rest touches it. Her body is always bracing for the next thing to go wrong, the next trauma exposure, even when she's nowhere near the hospital. It's like her body, her system, it just won't ungrip. She told me that it feels like she's living her life in quicksand. Everything just takes so much energy, and she has to push through so hard just to get the essentials done. Her DM to me resonated deeply as I read it, because I, probably like you, have lived a version of it myself. And so had the 90% of nurses that were in my recent audience of 250 at a National League of Nursing event recently. So if you feel that pit in your stomach too, stay with me, because this is probably going to resonate with you. So here's what happened to Claire. It was just an ordinary afternoon in the ED, the usual controlled chaos. Nothing and no one was escalating. Nothing felt different or off. She routinely walked into room 6, where a patient was having the worst night of her life. And to this day, Claire can't even recall what happened. All she remembers, and this is a trigger warning that we're going to talk about some workplace violence in this episode. So if that's a sensitive topic, please just hit pause and fast forward about 3 minutes. All she remembers is a hit to the face and jaw, and it arrived before she even could register that she had been struck. Time was standing still. The sound of her entire department, it fell away. The monitors, the beeping, the noise, the overhead pages, all of it was gone until there was only the patient's breathing and her own. Her own vision was blurry. Everything moved in slow motion as she and her team then started to stabilize the situation. It wasn't until after the event that she realized she was bleeding from her nose. This was Claire's third attack from a patient in as many years. So 3 attacks, workplace violence in 3 years. And you probably know, as well as I do, what the system did next. In the hours and weeks that followed, Claire did everything right. She followed every policy, every procedure, all wondering, what's the point of it all? She reported the incident and notified leadership. Check. And then leadership asked her the question, the one that we all have heard. What could you have done differently? Gaslighting? Check. Go to employee health? Check. Assign more computer-based training modules on de-escalation and resilience? Check. File the report with risk management? Check. And then, after some period of time, the incident just gets closed. And no one, not one person, formally checked on her well-being. That's not to say her team members weren't compassionate. That means that no one from leadership formally followed up to see how she was doing. No one screened her for trauma, let alone nurse-specific trauma. Check. The hospital veneered over another case of avoidable nurse-specific trauma, and Claire carried the physical injury and the PTSD that resulted from it for years. And in so doing, she vowed that she's never even going to bother reporting an incident of workplace violence again. And here's why that matters. Claire's story is not an outlier. It's the pattern. So let me share with you some of the numbers from the State of Workplace Violence in Healthcare report for 2025 and 2026. 84% of nurses reported at least one type of workplace violence in the last year. 63% of nurses feel anxiety, fear, or increased vigilance. 54% of nurses who experienced an incident actually reported it. 25% considered leaving the profession after the event, and 23% reported a significant physical injury. And only 20% of clinicians feel that they are adequately supported when a workplace violence or trauma exposure happens. Now, let's look at the other side of the coin, what the employers do. 59% of employers investigate what happened. 49% reprimand, blame, ignore, or discourage the employee from even reporting. Almost half. 38% provide a clear incident reporting process. So let's just sit with that math for a minute. Roughly 50% of nurses who experience workplace violence don't report it. And roughly 50% of the reports that do get filed are met with blame, shame, reprimand, silence, or discouragement. What does that tell you? Well, I'll come back to Claire, but if any part of her story is landing with you or in your body right now, I want you to do one thing. Head over to drlorilaws.com/assessment. The nurse-specific trauma assessment is free and it takes just about 1 minute. And it will tell you whether you're carrying burnout or whether it's something more, like nurse-specific trauma. So head on over to drlorilaws.com/assessment, and I will give you guidance for your next steps. All right, let's get back to Claire's story. We are asking the wrong questions, and it has left a Mack truck-sized gap in the evidence base. Nurses don't need more information. They don't need more computer-based training. They don't need more hollow referrals to EAP services that only 5% of nurses actually use. And why do you think those resources are so grossly underutilized? Because through the lens of nurse-specific trauma, nurses don't feel safe. And they don't feel safe because they aren't safe. It's like asking a firefighter to walk into a burning building and meditate, or to open themselves up in a vulnerable mental health encounter while the fire is still burning. Nothing signals it is not safe to report workplace violence, like having 49% of employers whitewashing the incident reports, minimizing them to lines on a spreadsheet, all while blaming and reprimanding or ghosting the nurse. And this practice, it's institutional betrayal. It's a form of nurse-specific trauma, a violation of trust that leaves the nurse carrying the psychological weight of a structural healthcare problem, burned and churned in a system that depersonalizes and marginalizes their traumatic events. And here's the part that the institution just refuses to see. The body, the nurse's actual body, is keeping the receipts and holding the ledger of the real impact. For example, Claire grinds her teeth at night now while she's sleeping, to the point that she has a molar that is cracked and has to wear a night guard. And when the dentist asked if she was under stress, she couldn't help but laugh. It was that kind of laugh that was half serious and half crying. So, or if someone approaches her on her left side too fast, a coworker, even her own child, her hands still come up defensively years later. This is not a memory. This is a nervous system keeping a record of what her mind is trying to still process and integrate. The nightmares, they never faded. And the sense of impending doom and fear and anxiety, well, it's with her every single day. And what this is called from Claire's body's perspective is the allostatic load of nurse-specific trauma. It's the perpetual wear and tear that builds in a body from the chronic and repeated exposures, the neuroendocrine response that never fully powers down. A recent systematic review found that nurses carry a high psychosocial allostatic load precisely because of the environments in which they worked. And an elevated allostatic load is a physiological state as well. It's not just a feeling or a mood or a personality trait, and it certainly is not resilience challenges or burnout. Nurse allostatic loads predicts illness and early death across multiple body systems. This is one of the many reasons why nurses are the sickest professional roles in all of healthcare. I covered that in issue 90 if you want to take the full picture. Not because we're weak, but because that load has to go somewhere. And if the institution won't address it and resolve it, then it's placed to burden the nurse across every dimension of their health. For over 50 years and at the expense of billions of dollars, they've been trying to solve this burnout problem. And they have not moved the needle, not even a little. My research asks a different question. What if it's not burnout? What if it's something more? And as it turns out, it was never burnout. Burnout is a symptom cluster of nurse-specific trauma. That's right. And Claire's story, the workplace violence, that's the allostatic load, a big part of it. All of this is nurse-specific trauma, and most of it is systemic, structural, and avoidable. This is what is driving nurses out of the profession in droves. A silent epidemic of nurse-specific trauma driven by the four conflating and converging forces all happening at once. The staffing crisis, being stretched beyond capacity, nurses being sicker than any of their colleagues, and suffering on a wide scale. I've been researching this for years, well over a decade, and I'll soon be publishing the results of my 2 nurse trauma assessments that surveyed over 800 nurses. So here's the sneak peek of what I found in one of those assessment surveys. Of 375 nurses who were assessed for nurse-specific trauma, 374 of them are carrying at least one marker of nurse-specific trauma. All but one nurse is carrying the allostatic load of nurse-specific trauma in a sample size of 375, and that's a solid sample size. That's not just a struggling few. That is nearly every nurse who sat down and was in an environment that was safe enough where they could be truly anonymous to answer honestly. So if I were standing in front of a live audience like I was recently at the National League of Nurses, that would be my mic drop moment. So here's the truth that I want to leave with you. If you recognize yourself in any part of Claire's story, this is your sign. This is the start of nurse awakening, the one that is no longer victim to the gaslighting, burnout, resilience, you are not enough narrative. You never were the problem. The system was. Now, next week, I'm going to talk about the fourth force, the suffering, and I'll be sharing another nurse's stories. So please keep sending those stories in. They matter immensely. I read every single one. I personally respond to each and every nurse. So take a quick moment wherever you are and send me a DM or email me at team@drlorilaws.com. So in closing, if Claire's story lives somewhere, anywhere in your body, start with the free nurse-specific trauma assessment at drlorilaws.com/assessment. It takes 1 minute. and it will tell you whether what you're carrying is burnout or whether it's nurse-specific trauma. And knowing that difference changes everything about how you recover. Your body never lied, the system did. And from my healer's heart to yours, and until next time, namaste.